Alright, so we're going to talk about the progress of the uterus throughout the various reproductive stages in the life of a woman. So, if we talk about a woman, firstly, we'll talk about the various stages that the woman has to go through. Number 1, infancy. Number 2, childhood. Number 3, puberty. Number 4 is menopause. So the ratio of the fundus to the cervix in each of these stages is 2:1, 1:1, 2:1, 1:1. So obviously there is a pattern, and this pattern depends upon the presence or absence of hormones. In infancy, there are hormones, and these hormones are the maternal hormones that have passed through the placental barrier to enter into the fetal blood, and as a result cause the uterus to become larger during infancy. During childhood, there are no hormones. During puberty, obviously there must be hormones, and at menopause, again, there are no hormones. Okay, one additional detail about each of these stages is that at infancy, the uterus is an abdominal organ. It is an abdominal organ. C for childhood, C for cervix, that is quite large during childhood. P for puberty, P for the uterus being a pelvic organ. Alright, also an additional detail is that during puberty and between puberty and menopause, a female can be pregnant or she may not be pregnant. If she is not pregnant, she can be a nulliparous woman, or she may be a multiparous woman. If she's a nulliparous woman, the uterine characteristics will be same as that in puberty. So we can write puberty over here. And if she is a multiparous woman, her uterus will be large, nodular, and it would be an abdominal organ. Finally, we are left with pregnancy. During pregnancy, the progress of the uterus can be compared to that of an inflating balloon. An inflating balloon, if we look at an inflating balloon, we will notice that its size increases, its weight increases, obviously because we're blowing air into it, and finally its walls thin down, thin walls. Finally, when the balloon is deflated, the balloon assumes its thicker walls. And finally, an additional detail about the uterus of a after the delivery is that it becomes edematous. So this is an easy way to remember the uterine changes during the reproductive life of a female.